Hello, everybody. Thank you for joining us. My name is Amanda Halley, and I'm here with my colleague, Audrey Cole, and we're from the Western Connecticut Area Agency on Aging, which is based in Waterbury, Connecticut. And we're happy to be here to share with you some very important information related to Medicare. Specifically, what I'll be talking about is the importance of reviewing your plans during Medicare open enrollment, which we are currently in. It started on October 15th and goes to December 7th. And Audrey will talk about various things that one needs to be aware of to protect themselves from Medicare fraud, errors, and abuse, particularly during this open enrollment period. Audrey, I'd like you to tell us a little bit about the agency, the Western Connecticut Area Agency on Aging.
The most important thing I want everybody to think about today is that if you have a question on Medicare, you should be calling our agency. As Amanda said, we're located in Waterbury. We're known as the Western Connecticut Area Agency on Aging. We are a not-for-profit. Our two programs, which we're going to discuss today, my program is Senior Medicare Patrol, and Amanda's is the Choices SHIP program, counseling. We are both cross-trained in each other's programs, so we can address any questions. But Western is located in Waterbury, and I have a little map here. I'm not sure if people can see it, but we have 41 towns at the Western Connecticut Area Agency on Aging. And of the 41 towns, we go to Salisbury, Connecticut, all the way over to Barkhamsted, down to Cheshire, and down to Reading and Ridgefield. So we cover 41 towns. I should also say that I cover an additional 11 towns. I go up to...
You're all over the state,
right,
my friend.
I go up to Enfield and Suffield. Those used to be part of the North Central Area Agency on Aging. There are 5. And we are located right here. This blue right in here, that's us. And I also handle some of these towns up there, up in green. And then on top of that, which is even a bit more confusing, I cover all the statewide cases in the state of Connecticut related to my program, Senior Medicare Patrol.
And tell them again what that means.
Well, Senior Medicare Patrol, you are going to talk about how to navigate Medicare, and I talk about how to prevent fraud in Medicare. So once you're on Medicare and you have an issue like an improper bill, let's say a provider sends something to you and you're like, I never saw that doctor. I didn't go to that lab. I didn't order that genetic test. So then you call me and I would report that to Medicare. The other thing is I educate people about fraud, and we go about, Amanda and I, educating people.
Exactly. We go around to senior centers, to libraries, and spend time presenting information on a variety of topics related to Medicare, whether it's the basics of Medicare, Medicare 101, and then Audrey will talk, as she says, about the fraud and errors and abuse portion, or we can talk about, right now with Medicare open enrollment, we go around to those various places I mentioned and talk about how to prepare yourself for open enrollment, what you need to do. And we're going to be talking and touching on some of those topics today. We also talk about how Medicare works with employers' insurance. We talk about how Medicare differs from Medicaid. So it's a wide variety of issues that we cover and that we share with the communities of the 41 towns that we serve.
So I just want to add, Medicare is very, very complicated. So a lot of people think, oh, I turned 65, I guess I should sign up for Medicare. But I want you to know there are tens of thousands of people between 18 and 64 who are also on Medicare, because we also service the disabled community. So if you could be in your 20s, and if you have a disability, after 2 years you would go on Medicare, and we will handle any issues in terms of choosing a plan to be in, or if you have a dispute or a problem, or you suspect a fraud has occurred, You would call me.
Some of the other programs that the Western Connecticut Area Agency on Aging deals with, in addition to what we do, we have a respite program for individuals and loved ones taking care of those diagnosed with dementia. We have a Live Well program that educates folks on how to deal with chronic diseases such as diabetes or cardiovascular disease, and things related to diet and exercise. We have a home care program for Waterbury residents. We have what we call service navigators. These are individuals, when you call in and you're connected to that department, you can explain to them what you're looking for, what your needs are, and they can direct you to the appropriate department within the agency, or refer you outside to another organization out in the community that can help answer your questions. One thing we want to talk about, Audrey, is the funding. You want to share how our programs are funded?
Well, both your program and my program, the Choice Your Share program and the Senior Medicare Patrol, are funded primarily by federal grants that are sent to the state of Connecticut, and the state of Connecticut administers them. So all our programs are unbiased. We are a not-for-profit. Amanda's program, if someone helps you enroll in Medicare, it's commission-free. We aren't paid. We aren't insurance brokers. We can't be paid. In my particular program, the 3 words I educate people on, I educate people about how to protect yourself from becoming a victim of fraud. I try and turn you into an advocate. How to detect a suspected fraud in Medicare, and then I report it down to Washington. So Amanda, tell us the importance. During open enrollment from October 15th to December 7th, which Amanda mentioned, a lot of fraud does occur. People get improperly switched by an unethical person who maybe will call them up and put them in a plan that doesn't meet their needs. So Amanda, talk about the importance of getting the correct plan during open enrollment and why our counselors are so important.
So one of the things that we are constantly hearing from folks who contact our office is, my plan worked great for me last year. The drugs were covered, the price was right, it was great. However, one thing that we do educate folks on is each year things change. What do I mean by that? The plans change, and what I mean by plans, I'm talking about the insurance plans, the Anthems, the Aetnas, the United Healthcares, the Cignas, the Humanas. How do they change? The pricing of the drugs change from year to year. The drugs they cover may change from year to year. Your health itself may change. Maybe you're no longer needing to take certain drugs, or vice versa. Maybe some more drugs have been added by your doctors. So these are the kinds of changes that one needs to take into consideration and look at plans and how it may differ from the current plan that you're on. Your finances are also a very important part of how you choose a plan. So what we do is we set aside an hour for counseling. It could be shorter, it could be longer, and we go through your needs, your drugs, your pharmacies. I mentioned earlier that the plans change the pricing of their drugs from year to year. Also, working with different pharmacies. Some pharmacies for plans are considered preferred pharmacies. Those pharmacies, you'll see the more competitive pricing. So again, your favorite pharmacy would perhaps still have the same pricing, maybe not. We never ever suggest to anybody to make any change they don't want. So for example, folks have their favorite pharmacy. That pharmacy, they've been dealing with the pharmacist for many years. They aren't going to want to change, or that pharmacy delivers. These are very important factors. So our job is simply to educate. So when we do look at plan comparisons, we go on the Medicare.gov website, a very wonderful resource, and we have on that website what's called a Plan Finder tool. What you do with that tool is you enter your drugs, your pharmacies, and what that software does is it sorts plans by the lowest premium and drug cost or out-of-pocket cost of the drugs. Point being, don't necessarily take the plan with the lowest premium because there are 3 important prices or costs to take into account when you're selecting a plan. It could be the premium, the deductible. The deductible is the amount that you pay before the drug or plan kicks in, and then the out-of-pocket costs that you pay when you go to pick up the drugs. So it's important to look at a composite figure of all those three drugs. So again, the important point here is don't assume that the plan that you are on this year will work for you next year. We did sort of a back of the envelope calculation of how much money we saved beneficiaries in our 41 towns that we serve, and I'm talking about counselors like ourselves. It was close to $1 million simply by taking the time to sit down. In fact, the other day, I was at a senior center helping a beneficiary, and just by looking at her plan, we looked at saving her over $400 simply by switching plans.
I remember I had one case one year where I can't stress how important what pharmacy you choose, because every drug company has a different contract with a different pharmacy. So we had one person, I think she took 8 drugs, and she went to her favorite pharmacy, but one of her drugs was $800 at that pharmacy. 2 miles down the road, because you can pick 5 different pharmacies in the plan finder, so we put in 5 pharmacies. There was one pharmacy 2 miles down the road that same drug was $100.
Exactly.
So she got the 7 drugs at her favorite pharmacy, but she was saving $700 a month by getting that much more expensive drug at a different pharmacy. We can't tell you why these prices are like how they are. They have different relationships and so forth, but it's just an example of how important during open enrollment to do these cost comparisons.
And it doesn't really take a lot of time. It can be done over the phone with us. We also communicate with folks using Zoom, or we go to local senior centers and libraries, and there's a listing on the Connecticut Department of Social Services website, and they list where the open enrollment sessions are in some of our towns, or you give us a call at the agency, and our number is 203-757-5449, and press option 4, and you can speak to any choices or SHIP counselor, and they can let you know where the nearest open enrollment session is taking place, or you can certainly pop into our agency.
And don't wait too long, because we do get really booked up. So it's very important. Don't wait like till December 5th or something to make an appointment. Because it's almost impossible at that point to get in. So make sure you make those calls as soon as possible.
The other thing I wanted to mention is we talked about drug plans. Now, when you're on original Medicare, Medicare, as many of you know, is a federal program. You get Part A, which is your hospital, Part B, which is your doctors, your scans, your blood work. Everybody gets that card. Then you choose how you want to get your Medicare. Whether you want to do traditional or original Medicare, you pick up a separate drug plan, also known as Part D, and if you want what's called a supplemental plan, because Medicare, I'm just going to back up for a second, Medicare pays 80% of a Medicare-approved procedure, and you're responsible for the 20%. There are private insurance companies out there that you pay a monthly fee to, and they will pick up the 20% if Medicare pays. So that's a prescription drug plan, or Part D. You also have a choice of choosing a Medicare Advantage plan, and many of the Medicare Advantage plans available in Connecticut include a prescription drug plan, so you don't have to purchase a separate prescription drug plan. So regardless whether you have a separate Part D plan under original Medicare or a Medicare Advantage plan with a prescription drug portion to it, it's important to review the drugs. In addition, on the Medicare Advantage plans, healthcare providers can opt in and opt out at any time, so you need to make sure next year your favorite doctors are still taking the plan.
And I do want to emphasize, because when I get calls, one of the first questions I ask people, what plan are you on? And many people don't know. If you're on original traditional Medicare, how I handle a case is completely different than if you're on a Medicare Advantage plan. And we assist people with both plans, both original traditional Medicare if you're on a Medigap. When I have a case and there's a dispute, the dispute usually is with Medicare, because if Medicare pays the bill, your supplement plan will automatically pay the 20%. So the real issue is whether that treatment or procedure was covered by Medicare. It's very different with a Medicare Advantage plan. They have prior authorization. When you sign up for Medicare, you get that red, white, and blue card, A and B. You have the option then to opt out of traditional Medicare and sign up for a private insurance plan, which is a Medicare Advantage plan. We tell people, because we sign people up for both plans, but we do tell people the most important choice in choosing a Medicare Advantage plan is getting all your medications lined up to make sure they're properly covered, and 2, make sure all your providers are covered. And we even go the extra step and say, call your doctor. Ask them what they think of the plan. Because some doctors will tell you that they don't like working with certain plans or they have difficulties with it. So it's really important that you have that discussion with your doctor. For me, how I handle a case, if you have a private insurance Medicare Advantage plan, you really have to work with them first. And I can walk you through that to settle the dispute. It's completely different if you're on an original traditional Medicare. I can still help you, but how I help you is a bit different.
So it's so important to look at your cards that you have, because many times we get calls from folks and we ask them what they're on and they don't know. No fault of their own, because let's face it, Medicare is incredibly confusing. And even for us, there are changes made all the time that we need to keep up. And because our funding is from the federal government through the state, we are always apprised of all the updates. So we are on top of that information, which is good. But that's where we become the resource for folks, because again, there's such confusion out there. Our job is to untangle it and have you walk away with a clearer understanding.
And the reason it's so important to call our office, for example, if you were to call Medicare and ask them certain questions, you might get a wrong answer, because Medicare and Social Security are federal programs. They aren't as familiar with all the state programs that work with Medicare and Social Security. For example, we can't leave tonight without talking about the wonderful Medicare Savings Program. Some of you may have a little gray Connect card, and this is an extremely important program. Amanda's going to highlight
I consider the Medicare Savings Program, and thank you for bringing it up, the best kept secret in the state of Connecticut. It is a type of Medicaid, but it is federal. It's not like the state Medicaid known as Husky here in Connecticut. The other thing about the Medicare Savings Program is it looks at income only. It doesn't look at assets like regular Medicaid does. It looks at gross income. Okay, that means before anything is taken out. So if your gross monthly income as a single individual is $3,209 or less, or if you are a couple and your gross monthly income is less than $4,336, you may be eligible for this program. Now, this program is administered through the Connecticut Department of Social Services. They're the ones that the applications go to. They're the ones that make the decision. What we can do is we can screen you and say yay or nay whether we think you should apply. We can help you fill out the paper application. We also have the capabilities of helping you apply online. Now, the interesting thing that we get a kick out of is some people say, oh, well, I'm still working, and I can't possibly be eligible for the program. Well, guess what? The state has this cockamamie formula that they use. So they take your monthly wage, they subtract, I think it's $65, and then they divide that in half. Well, that's significantly less than putting your entire monthly wage on that list of income. So what we say to people, don't be discouraged if you're still working. Once you apply this formula, you still may be eligible.
And there are 3 levels to that program. At
Exactly.
a minimum, it will pay that Part B monthly premium, and it will lower your drug costs. There isn't, the level in terms of, there is a level that's similar to Medicaid that will assist and make that co-payment. But at a minimum, this helps a tremendous amount of people in the state of Connecticut. And you could qualify. You should call our office at 203-757-5449. Ask for Amanda or myself or any choice of ship counselor, and we'll get that application out to you, or we will assist you. But it's an invaluable program. Not enough people know about it. I do have a little caveat. Every March, the numbers change.
Yep.
And we aren't sure what's going to happen. You hear a lot of news about changes at the federal government, so we'll wait and see. But Connecticut's a very expensive state to live in, and the state wants you to stay in your homes, and they provide this wonderful assistance. So if you don't know about it, we're here to tell you about it. If you call Medicare or Social Security, they won't know about it, because if you go to Massachusetts or New York, those income levels are much different.
Exactly. Every state in the country has this program. But as Audrey said, ours is very competitive and has very high income eligibility cutoffs because of the cost of living in Connecticut. And again, to reiterate, all 3 levels pick up that Part B premium, which is taken out of everybody's Social Security. Currently, it's $185. In 2026, it'll go up. We don't have the exact figure at this point, but that premium everybody pays. It also gives you extra help paying for your prescription drugs, where it caps generics at a certain amount, as well as brand name drugs. So all 3 levels do that. The 3rd level, called QMB with the gray card, serves as a supplemental coverage. It will pick up that 20%, provided, there's the caveat, that the doctor or healthcare provider, doesn't necessarily have to be a doctor, accepts Medicaid.
And keep in mind, this program is very different from state Medicaid, which in Connecticut is known as Husky. There's Husky A, B, C, or D. If you, for example, a single adult and you're under 65, a lot of people are on Husky D. And it shocks people sometimes when they go off a Husky D, because the Affordable Care Act, also known as Obamacare, has many more generous benefits than Medicare. And they're like, well, I want to stay on Husky D, and they cannot. At 65, unless you continue working and you have employer insurance, or depending on if you have a large company that you work for, there are circumstances where people don't, but most people, without exception, have to sign up for Medicare, at least Part A, and if they continue working. But it's, as I said, Medicare is very complicated, so your situation is very unique. The one thing that we can't do is when you call us up and you say you want what your neighbor has.
That's right.
That's one of the first things people say to us.
Or my spouse.
Right. You have very different health needs than your partner or your neighbor. And also, aside from that, your neighbor, other people, you don't know their finances. And based on your finances, there may be a better program for you. Exactly.
So it's really important. Take the time to look at your plans. Let us help you do that, because the best way to do it is to create a Medicare.gov account on Medicare.gov, because it will give you access to that Plan Finder tool. And what you need to do that is not a lot of material. Simply your Medicare card, your red, white, and blue card is important. Your home zip code. This year, they require now an email address, and now they have a double verification process which is required. You then input your drugs, including your dose. Is it 40 milligrams, 20 milligrams, how many times a day you take it. Is it once a day, twice a day? Is it a capsule? Is it a tablet? And then you put in at least, as I think you mentioned, at least 3, maximum 5 pharmacies, because as Audrey mentioned, costs can change between pharmacies. And once you do that, it will sort by lowest premium and drug cost. And again, this is where we can help you, walk you through that whole process.
And I have to say, if you have a Medicare.gov account, so if you're on original traditional Medicare, you get statements quarterly, I need to look at those statements because people will say, hey, I was just billed $8,000 for diabetic supplies and I'm not a diabetic. If you have a Medicare.gov account, we can also get that statement directly.
Right off the website.
Right, because if you have that account, you can look at that monthly. The actual mailings that you get are quarterly. So depending on the case, I can get those documents quicker because I need to document the fraud. So that's very important that you read your Medicare summary notices, or if you're on a Medicare Advantage plan,
Right.
they're called explanation of benefits, or a separate drug plan, explanation of benefits. So
Very, very, very important to be able to do that. Because as you say, to use your words, folks are the eyes and ears of your
Yes.
program. By looking at those documents, you folks can bring to Audrey's attention any inconsistencies in what you receive on your plans,
Yeah,
or if your friend brings that to your attention and shows you their plans or has questions.
66 to $100 billion a year are lost through Medicare fraud every year. That's reported. So as Amanda said, the eyes and ears on the ground are you. So please give us a call. Before we close, I just want to say that Amanda and I are talking about doing a call-in show specifically related to answer all your Medicare questions. If you're interested in doing that, please call the station and let us know if you'd like to have a Medicare call-in evening, and we can answer all your questions. You can even send some in ahead of time to our office, and we'll know what they
Absolutely.
are, and we can get the answer directly. We deal with all types of interactions with Medicare. If you have employer insurance, we have some veterans who interact with Medicare. They have their
Absolutely.
veteran benefit,
Yep.
but then they also sign up for Medicare.
And people moving from different states, give us a call. Wonderful resources out there, the Medicare and You 2026. We call it the Bible, very important. In addition, Medicare.gov is a wonderful resource. Again, creating online a Medicare.gov account and then calling us. We're the first door to Medicare.
And I have a handout, all the frauds that happen during Medicare open enrollment. So watch out for phone scams. If you're changing, watch out for social media scams. There is no such thing as a Medicare certified broker. Medicare doesn't certify anybody. There are insurance brokers who can sell you Medicare Advantage plans or Medigap plans. We don't sell you anything. We are unbiased and commission free. So give us a call at 203-757-5449. Anything else on the closing?
No, we thank you for your time. And again, please don't hesitate to give us a call. We are happy to help. Or if it's not Medicare related, call our office if you have questions about other issues, whether it's respite program, whether it's legal, home care. We will be able to direct you to the right source.
Okay, thank you so much.
Thank you very much for joining us. We really appreciate it.